Hello folks, how you doing? Don Kelly here. Hope you're all keeping well. Happy Wednesday to you all. Just doing a quick live video. I'm on my wee coffee break here. So patient coming in about 15-20 minutes. So taking a little break. So a good opportunity to make a live video. It's going to be about 3 or 4 minutes. I'll keep it quick. And so because for obvious reasons we don't want to be hanging around looking at me. Now, today's tips, we're going to talk about knee pain. And I'm going to give you some tips on if anyone out there who has knee pain, what may be causing your knee pain. Okay, so to give you an idea, there's more than one issue that can cause discomfort and pain in the knee. And I'm just going to give you a few little ideas that might give you an understanding what may be causing your knee pain. Now, listen. If you have chronic knee pain or anything like that, you should always get it checked out by your professional, by your medical, your GP or doctor or whatever. But either way, 1 second there, and I would turn it on. So either way, I get it checked out, especially if it's an ongoing knee pain and if it's kind of come out of nowhere. All right. So, okay. One tip on knee pain, okay, for example, if your knee is hurting you on movement, i.e. if you just bend your knee up and down, and every time you move the knee, you get pain, or if there's pain in it when you walk, general activity on the flat, it's generally a sign it's a muscle injury, okay, it's a muscle issue. If there's pain at movement, and especially if there's no pain at rest. So, for example, if you find that when you walk or run or doing jogging and you get knee pain, but when you stop it eases, that's usually the sign it's a muscular injury, okay? Be it at the front or at the back, okay? If there's pain in your knee at rest, so that would be if you're sitting down and at home resting, working at the office, at the desk or watching the telly, whatever, and you get knee pain. But then when you go to move and you find that alleviates the knee pain somewhat, then that generally tends to be an indication of a ligament type injury or an injury maybe at the meniscus or the cartilage within the knee joint. Tends to be the indicator of a joint issue, be it ligament, cartilage or something going on in at the joint, even underneath the patella, the kneecap. So if it's sore at rest and relaxes and doesn't hurt that movement, the movement eases it out, that tends to be an indication that it's a ligament, joint, cartilage type issue. Okay. Now, if you're getting knee pain when you go up the stairs or down the stairs, but you have no pain on the flat, so if you're walking, going from the dining room to the kitchen or just walking around and you don't have knee pain, but you start to get some knee pain when you try to walk up the stairs or try to come down the stairs, okay, or if you get some knee pain when you're sitting and then going from sitting to standing up, that type of knee pain, but then it eases out on the flat, that can be an indication that there's something going on at the kneecap. Okay, so there can be many conditions going on there, but generally that type of discomfort can indicate a dysfunction at the patella, the kneecap, and maybe an overactive quadricep muscle, okay? So that could be fairly overactive and that can pull on the kneecap. So when it's being overloaded, going up or down the stairs or going from seating to standing or sometimes standing to seating, that overloads that area there and that can cause that can be reason for that type of pain. Now there's other pain then as well. You should check your knee. Is your knee swollen? So do you compare your bad knee to your good knee? And if it's swollen compared to the other knee, that will definitely reduce the range of motion in knee flexion, and that can cause a lot of discomfort around the knee as well. So check, is your knee swollen? So that can come from a number of issues. Did you bang your knee? Is there fluid retention in the knee? Possible rheumatoid arthritis or something going on in the knee that's causing the inflammation, okay? Could be a bit of inflammation on the bit of patellar tendonitis. It's a repetitive strain injury. Or did you get a sports injury where you got a bang, or where you twisted the knee? Okay, so that could be the indication of quite possibly an ACL, PCL injury, or a ligament injury, or a joint injury, cartilage. It usually comes, that type can come from a twisting, sudden twisting motion. So there's usually a mechanism to that. If there hasn't been a mechanism to that type of swelling in the knee, check, are you getting swollen in other joints as well? The fingers, the other knee, 2 knees, are they swelling? Are you getting pains in your fingers, your knees, your ankles? That would need to be medically investigated. So if you're getting kind of all over joint pain, it's more of a systemic kind of issue that you may be having there. So that would need to be checked out as well. Okay, and a swollen knee, you'll find as well, is there more bony articulation as opposed to the good knee? That can be an indication of osteoarthritis, okay? So you'll see the kind of bone will slightly be protruding, or you'll notice it more than the other leg. That can be an indication of knee osteoarthritis. So that's where it's actually bone on bone, where the cartilage is gone, it's worn away, and the knee joint is just bone on bone. So when you walk, it causes discomfort. And a little signal for that is, when you get up and you walk initially, you get pain, and then it will start to ease out after a little period. And then if the walking continues, the pain can start to increase there again during the walking cycle or weight bearing cycle. That could be an indication of bone on bone. All right. So look, there are just a few little tips. They're not written in stone, okay? They're general guidelines, but hopefully that will help give you an idea what, if you're getting knee pain, what maybe the causes of it. The main thing with any pain is it's not normal, and don't do any exercise that aggravates the pain. So you don't want to be doing anything. If you have knee pain, going for walks or running, don't run or walk through the pain. You need to stop, have a barrier, because if you walk or exercise or train through pain, all you're doing in the long term is creating trauma to it, irritating it, and making it worse. Okay? Hope that helps, guys. Quick video. Have a great Wednesday. Thanks for watching. I appreciate it. If you have any queries, any questions, please feel free to ask me. I will leave a link in the comments box below. It will be a link to my private face group page, where I'm going to be doing more in-depth answering questions and things like that. So most of the people who are in my group are previous clients who've been to my clinic, so it's something I want to give to them. So in that group, you can ask any questions. So I will leave a link later on. Join the group, and I will be doing some more talks on knee pain and how to help your knee pain as well going forward. Okay, so thanks for keeping in touch. You like the page, please share it. Leave any comments, any questions. I'm always here. Have a great day, and we'll talk to you all soon. Thanks for watching. Bye.